right? So jump to the brands and we understand. Just a bit. Okay. OVA Thrive. We have the one brand that is called the OVA Thrive, right? OVA Thrive. Basically, OVA Thrive friend is made for the those patient have the PCOD problem, like PCS or PCOD problem. For that, we have made the OVA Thrive. Here we have given the myoinositol with the D-carinosinol in the ratio of 40:1. Right? We have given the in the 40:1 ratio. That is the ideal. That is written here. Myoinositol and D-carinosinol, it is in the 14:1 ratio. That is the ideal for the efficacy. So before understanding the brand, first we understand what is the PCOS actually. What is the PCO, PCOD or PCOS? Both are the same thing, right? You can speak like PCOD or you can told in PCOS, polycystic ovarian syndrome or polycystic ovarian disease. The meaning of both are the same. What is the PCOS? So PCOS, friend, it is a hormonal disorder affecting the reproductive woman. Basically, this happen when any female have the reproductive activity. Reproductive means after the 13 year or 14 year, female have the reproductive means their menses is started. If any female have, any girl have they started their menses, now they are ready for the fertilization. They are ready for the pregnancy, right? Because of that reason, in many time you have seen in the market early marriage. They have the early marriage in 16-year girls, then they have the baby, right? So when period started means their body is start producing the eggs. In yesterday's session, we studies that every woman or every female born with the thousands of the egg, and every month one egg is matured, right? Same thing we have studied yesterday. Ki one egg mature every month. When it is fertilization happen, if fertilization happen, then the baby will born, and if fertilization not happen, they come out as a menses, right? So PCOD, it is a hormonal disorder where hormone they affect the reproductive age woman, cause the irregular periods, infertility, weight gain, acne, and insulin resistance. First, if any patient suffering with the PCOD, they have the irregular period. The period generally happen in the every 28 days or 29 days. But then irregular period means sometimes period come in the 40 days, sometimes they come in the 45 days, they sometimes come in the 35 days. It every month there is no fixed system. Or sometimes they come in the 10 days. There is no fixed system. That is called the irregular period. Right? There is no time for the period. Anytime they will come. Right? That is called the irregular period. Second is the infertility. If period is not regular, means mature egg is not available. Right? If period is not regular, means mature egg is not present. So fertilization will not happen. So patient if suffer with the PCOD, in current days, PCOD is the biggest problem in the infertility, right? So because of PCOD or PCOS, patient can't fertile, can't go for the pregnancy actually, right? Third problem with the PCOS is the weight management. The weight gain happen, right? These all the symptoms, it is not necessary to come in the one patient. Different patient have different symptoms. Some patient have the weight gain problem, some patient have the infertility problem, some patient have the irregular period, right? It is not, it can be all the symptoms in the one patient, and it cannot be all the symptoms in the one patient. It's totally depend upon the patient, right? And insulin resistance also cause obesity, right? When any patient is have the insulin resistance, they automatically means when obesity happen, then insulin resistance is happen. And because of this insulin resistance or due to obesity, patients sometimes have the diabetic, right? And one is the another problem is the acne. Some patients have the acne problems. They are in the pimples come out. Many acne come out. So many time patient for the PCOD treatment reach to the dermatologist because they think that this is the skin problem. But that particular problem happened because of hormonal disbalance. Because of that reason, जो dermatologist हैं, the dermatologist doctors also prescribe the PCOD medicines. Dermatologist doctor also prescribe the hormonal like Yamini, Padmini, this type of medicine they also prescribe. These are the hormones basically, right? These are not prescribed by the dermatologist because patient complain for the acne. So acne, it may be sometime due to skin disorders, but sometime it may be due to hormonal disorders, right? So both things happen. So many patients go to the dermatologist. Linked to the high insulin, androgen excess, and inflammation. These three things happen when PCOD happen. High insulin level, right? Means when insulin resistance is happen, then body produce more insulin to utilize the glucose in our body. What is the function of the insulin? Insulin basically they are the gatekeeper for the glucose molecule, right? They work like a gatekeeper. They open the gate and glucose molecule enter into the cell and work as energy. Yesterday we learned our body why need the food for the energy, for the working. For the working, our body means our cells need the energy, right? In our body, energy is a form of glucose, right? In our blood, we have the glucose molecule, right? They just fuel the cells for the regular functioning. So insulin work like a gatekeeper. They open the gate and glucose molecule enter into the cells and cells utilize and work. This is a simple process happen. But when insulin resistance happen, the insulin is not work. Means insulin doesn't open the gate. And because of that reason, glucose molecule start accumulating in the blood itself. And when we go for the testing, then glucose level is higher side. And the same message is, if goes to the brain start producing more insulin level. Brain think that insulin is not available, because of that reason they not open the gate. So start the more production of the insulin and androgen level. They also, because of high insulin, the androgen level also excess. What is the androgens? Androgens are the hormones that develop the male characters. Miss Daddy, Moose, Miss Save, Heavy, Wise, right? Even that in the field you have seen some females have their beard, actually small beard. Some females have the big beard, right? Just because of this androgen. Androgen is responsible for the male characters, right? So androgen level also start increasing, and due to these, inflammation will increase in the body. These are the common symptoms of the PCOD, right? This is the common symptom of the PCOD, and these symptoms identified by the doctors: insulin resistance, hormonal imbalance, genetic inflammation, poor lifestyle. On behalf of that reason, because of these reason, irregular period, excess hair growth, weight gain, acne, dark skin patches, these symptoms seen. So these are the common symptoms of the PCOD. Then here we understand how our brand is tackle this entire system. When any female have this type of symptoms, they have one another problem. That is anxiety. Right? When any patient, any female have the infertility, a patient have the acne, patient have the heavy weight, then simply they goes in the anxiety and stress, right? किसी को बच्चा नहीं हो रहा है, they are not fertile. This is the very big issue, and our society also blaming herself, right? So this is very stressful condition, or in this we have the solution with the OVA Thrive brand. We have launched the OVA Thrive sachet, right? We have launched the OVA Thrive sachet. What we do in the OVA Thrive sachet, we have the combination of myonistal and D-chironostal with melatonin. Melatonin is popular for the relaxation. Separately, melatonin also available in the market. Patients are taking because in the stress condition for the sound sleep. Those patients have the problem in the sleep. They have the sleep disorder like apnea. So they have take the melatonin for the mind relaxation and for the sleeping. Overall, melatonin is the medicine that prevent the stress actually and give the relaxation to the body and induce sound sleep. Right? When sound sleep is happen, because of that reason, body also relaxes. So in the market, when you look at the brand composition, very few brands have the melatonin combination. Many brands, those doctor are prescribing myonistal with the D-chironostal, alpha lipoic acid, N-acetylcysteine, folic acid, coenzyme Q10, vitamin E, and choline, and piperine. We have this, but in the competitor brand, this combination is not available. This is the very unique combination we have come up for the PCOD management. In this combination, friend, we have tackled three problems. With this combination, we have tackled three problems. One is the insulin resistance, which are taken care by the myoinositol and D-chironositol. They improve the insulin sensitivity. Second, second, we for the pregnancy we need three things. One is the good quality OVA, right? Second, ovulation, and third is the a good environment. Means patient have not any stress, patient have not the much weight. These three conditions especially we required for the good pregnancy, right? So in OVA Thrive, those symptoms occurred in the PCOD, we manage it. Here we have added myoinositol and D-chironositol, which is responsible for the insulin sensitivity. They increase the insulin sensitivity and reduce the resistance. Also, myoinositol helps the ovarian function. Ovarian function means they improve the ovary to make a good quality of ova. Are you understand what is the meaning of ova? What they do? Sarad, what is ova? What is the function of ova? Have you remember something? Yesterday we talked one female reproductive system, and that particular system we study two hormone, LH, luteinizing hormone, and FSH, follicle stimulating hormone. So what FSH, what they do? Have you remember the work of FSH? FSH. Sanjay, have you remembered that work of the FSH?
The sperm and egg, where the sperm and egg gets meet with the follicular tube nucleus. Oh,
What is the function of FSH?
fertilization.
No. Yesterday I explained FSH, follicle stimulating hormone. FSH is the hormone that develop the ova, follicle. They develop the follicle. Understand? It is
Yes.
responsible for the follicle. If the good quantity of FSH, follicle stimulating hormones, means this is the hormone which are responsible for the development of the follicle, for the development of the egg. If FSH present in the good quality, they make the good quality ova, a good quality egg, right?
Yes, sir.
So myoinositol and D-chironositol, what they do, they go in the body and increase the insulin sensitivity, and because of that reason, FSH label and LH label. LH means luteinizing hormone. They are responsible for the ovulation, right? They are responsible for the ovulation, and FSH is responsible for the development of the follicle. They create a good quality follicle, right?
Yes, sir.
So insulin, what they myoinositol and D-chironositol, what they do in the body, we have a lot of clinical trials actually. The 40:1 ratio is helpful in reducing the insulin resistance as well as improve the ovarian function with the help of LH and FSH. Right? We have the second ingredient, melatonin. Melatonin, it is work like an antioxidant, and they maintain the sleep wake up cycle. That is also called the circadian cycle. Right? Circadian cycle. Circadian cycle means what? Circadian cycle means when we sleep and when we wake up. This is called a circadian cycle. So if you maintain your circadian cycle, then health issues is not there. But many people, there is no timing for the sleeping and there is no timing for the walk. They many times they sleep at a 10 o'clock, many times they sleep at a 11 o'clock, many times they sleep at a 3 o'clock, depending upon the reel. They just scrolling the reel and wake up. Sometimes they wake up at 7 o'clock, sometimes they wake up at a 12 afternoon. So their circadian cyclic disturbed. When circadian cycle is disturbed, then chances of a lot of diseases, right? So if you maintain the circadian cycle, then you have the good health. So this is also called a sleep wake up cycle. The melatonin is the drug that maintain the circadian cycle. Understand? They helpful to induce the good sleep, actually sound sleep, as well as they also improve the egg quality. They also improve the egg quality, yeah, ova quality, or oocyte quality, or follicle quality. These are the meaning is same. We can say the follicle, we can say the oocyte, we can say the ova, we can say the egg. So melatonin also improve the also improve the egg quality or oocyte quality, right? So FSH is responsible for the development, proper development. Melatonin is help to make a quality eggs. And we have also given the antioxidant, some antioxidant like alpha lipoic acid. They reduce the free radicals that damage the healthy cells, they damage the healthy ova. So here we have added the alpha lipoic acid. Alpha lipoic acid also increase or support mitochondrial energy, right? Mitochondrial energy that give the energy to the egg or follicle to easily produce, actually, right? And here we have also added N-acetylcysteine. N-acetylcysteine, it is a precursor of the glutathione. What the glutathione? Glutathione is a basically type of antioxidant. Glutathione is a very powerful antioxidant, very powerful. Some chronic segment disease, doctors use N-acetylcysteine on the glutathione. This is the very powerful as compared to the other antioxidant. Glutathione is a very powerful antioxidant. And many patients taken for the glutathione taken for the skin brightness. If you're taking the glutathione 500 milligram for the 1 month, then your skin will be brighter, right? And in PCOD case patient have the stress, dull skin, and acne. So because of N-acetylcysteine, patient get more brightness on the skin side, more freshness on the skin side, right? As well as N-acetylcysteine also work on the liver, so do the liver detoxification and help create a excess hormone, clear the excess hormone, right? So we are not going for the liver detoxification, but explain to the doctor. Here we have added the N-acetylcysteine, which are the precursor to the glutathione, right? Which is a very powerful antioxidant that increase the insulin sensitivity as well as reduce the inflammation and is also increase the skin brightness. Folic acid basically responsible for the DNA synthesis and the cell division. They make the healthy DNA synthesis. Also, they prevent the neural tube defect in pregnancy, right? So, but here we talking only for the DNA synthesis, good DNA synthesis. And coenzyme Q10, yes, this enhances the mitochondrial function, mitochondrial energy also. And so, because of the if mitochondrial energy is good, then they increase the egg quality and embryo development. They help in the pregnancy basically, right? So coenzyme Q10 help in the pregnancy. Clear to everybody?
Yes, sir.
Some other antioxidant we have also added like vitamin E for the nourishment and maintenance of the hormone, choline that improve the brain function and neurotransmitter. So those patients have the stress, anxiety, they helpful. And piperine. Piperine, they increase the bioavailability of other, they increase the work of the other ingredient, right? They enhances they enhances the work of other ingredient. But those are the ingredient, chlorine, vitamin E. These are the basically piperine. What they do, they increase the function of the other whatever ingredient we have added here. So it makes us a very good package, very good sachet for the PCO management. Clear?
Yes, sir.
So battle against PCO, the warrior up Metaboland. Yeah, just I'm creating one story actually, right? Just I'm creating a story for your understanding. Here the villain is, this is the name of the any area, right? Metaboland. And Metaboland here in Metaboland, this is PCOD is a villain, just work like a villain, right? They spread chaos, causing hormonal imbalance, insulin resistance, and infertility. What PCOD do? Basically, PCOD is a villain. They basically cause the insulin resistance, hormonal imbalance, and infertility. But a team of mighty warriors like our like our brand, यार आप कितनी जल्दी भूल जाते हो आप, ओवा थ्राइव. This is the warrior, right? This is the warrior that contains myonistal and D-carrier. The twin strategies improve insulin sensitivity and regulate the ovulation. Melatonin, that night guardian, enhance sleep, reduce stress, and improve egg quality. Alpha lipoic acid, you can take the screenshot also. Alpha lipoic acid, the energy commander, boosted mitochondrial function and insulin insufficiency. And N-acetylcysteine, that detox the warrior, clear toxins, improve insulin response, and reduce the inflammation. This is the basic work. If I compare with the other brand which are present in the market, most of the brand not have the melatonin. The three major problem when any PCOD patient have, if any patient have the PCOD, they may face the three major problem. One, the obesity. Second, the insulin sensitivity. Third is the stress. So other competitor brand, they manage only insulin sensitivity and hormonal balance. They are not managing the stress. So stress is also a big reason when any couple, any married couple have not the baby now, they have the lot of stress. So in our OVA Thrive, we have added the melatonin to address hormonal balance, insulin resistance, and stress. Along with that, we have also the weight management solution. So in case of PCOD, in case of PCO, PCOS, or for the embryo development, female infertility, endometriosis, IVF, and ART. Doctor, please prescribe OVA Thrive. Right? If any patient go for the IVF or ART or endometriosis, right? Endometriosis means many times the patient have not stabilized the baby. Female infertility due to different reason, many times reason is not known. So female infertility happen, right? So embryo development for the baby development when the fertilization happen, and for the PCOD and PCOS management. So prescribe the OVA3. Have you understand the brand?
Yeah.
How our brand is different? Because most of the brand in the market, they are selling only just myonistal and D-carinosterol along with the some multivitamin. Most of the brand in the market. Most of the brand. Yeah, some brand have the melatonin, but their number is very few. And they sometimes they are present in the tablet form, so they are not giving the right combination or right dose. Brands are giving the myonistal in the 5 milligram in the tablet form. So 5 milligram is not sufficient actually, right? We are giving the accurate dose of the myonistal that will helpful for the PCOD patient. And cost wise also economical as compared to the other competitive brand. Those brand available in the market, they have costing something around more than 30 rupees to the patient. If look at the competitor, just share the competitor. What is the MRP of our brand? अरे रखा हुआ देख लो ना उठा के यार.
₹57.
Hmm?
₹57.
57 rupees for
Per box. Yes.
one. It is in the strip or tablet form. Oh, sorry, sachet form.
That's loss.
Open the packing also.
20 packets good.
It is in the sachet form or tablet
Sachet
form?
form.
Sachet, sir.
Sachet form, no? Okay, one sachet costing
57 rupees.
₹57, sir.
57 rupees. Okay, so look at the brand. These are tablet. If you go for the PCO, look at this mannitol, vitamin D, and just other multivitamins. Even that they have not added the melatonin, but the price of the brand is the brand of is combo of 3 boxes, combo of 2 boxes. If so, costing around and one box contain how many sachet? This is the 2 gram sachet and box contain maybe 10 sachet, right? So maybe 10 sachet. So MRP is, if you calculate, means if you compare with the other brand in the market, now our brand is economical. 1450 divide by 20. 2 boxes, right? So one sachet costing the 72 rupees. One sachet cost the 72 rupees. Vira Wellness. A lot of other brands also available in the market. Whatever is in just. And this OA Grace granules, they have just given the only myonistal, folic acid, and vitamin D3 granules. They're selling at 36 rupees. Only they added the myonisitol. Right? Just only. And the concentration of what is the concentration of myonistal? It's 2 gram. Right? They're giving the myonistal, but D-chironistal is not present. And if you look at our brand, we have given the scientific combination because for the good effectiveness, we need 40:1 ratio myonistal and D-chironistal. This is the right combination. A lot of papers also available. If you Google it, a lot of papers will you can read the papers or clinical trials. We also share these papers, right? So you can share with the doctors also what is the right combination. And as compared to the other brand, we have the selling the economical brand in PCOD care, right?
Yes, sir.
Yes, sir.
So just explain the composition and beauty of the brand. Okay. OA Thrive. Have you any question related to the OA Thrive? Sarad, have any question? Have you understand the brand OA Thrive for which patient, which indication? What actually OA Thrive, what they do? Where you use Ovathrive sachet?
Fertility.
Hmm?
Human fertility.
Human fertility? No. In PCOS and PCOD.
Yes, and this
In PCOS and PCOD and female infertility.
human.
Right?
Yes,
Where? In female. If human fertility आप बोलोगे तो मेल भी तो आ जाता है. Right? In female infertility, PCOS and PCOD. Right?
Yes, sir.
Clear?
Sir.
Okay?
Yes, sir.
Yes, sir.
Sanjay,
Sir.
understand?
Yes, sir.
So this is the unique combination we have come up in the Ovathrive brand, and the combination is scientific combination because 40:1 ratio is required to treat the PCOS, right? And others as a competitor brand, if you look at the competitor brands in this market, so most of the sachets from the Acoms, from the other company, Acumentis, those have costing more than 60 rupees for the same sachet. Same sachet means not same exact combination, but similar combinations, right? Those have the with melatonin, right? So
Okay.
here just study these the point why okay, here we have written the L-methylfolate. L-methylfolate is an active form of the folic acid. So look at the, we have added the folic acid. Okay, this is the active form of the folic acid. Because of that is in here written here. The L-methylfolate is essential for the healthy egg development and the DNA synthesis. Right. So practice well this visualate, and if you have any doubt, then you can ask. But here, advantage of melatonin in the female fertility. When you detail these 2 point, this 2 point is very much important. So just explain this point in Dr. Chamber. Restore oxidative balance, protecting eggs from oxidative stress and improving their quality, and enhance oocyte quality, increase the number of transferable embryos, and improve ART success rate from 20 to 30%. When you visit any IVF center, right? When you visit any IVF center, then explain this point. So our brand OVA Thrive is very helpful for the PCOD patient and for the IVF patient. When gynec want to improve the quality of egg, before doing any IVF, first they improve the quality of egg, then they do the fertilization process. Okay.
Yes, sir.
Yes, sir.
Our next brand is Spermify. Next brand is Spermify. Spermify Pro, because here we have given some advanced composition for the sperm development or sperm concentration, right? Here basically we have added L-carnitine, L-tartrate, Withania somnifera, coenzyme Q10, omega-3 fatty acid, zinc, lycopene, folic acid, selenium, vitamin D3, and cyanocobalamin. What they do basically nowadays, like female infertility, male infertility also increases, right? Like male infertility also increases continuously. So in the male infertility, the major reason of male infertility is the low sperm count. And what is the meaning of low sperm count? What is the concentration? When concentration reduce the below the 15 million per ml. What is the normal concentration?
2 billion.
Hmm?
I think 2 billion.
Billion or million?
Billion, billion,
Million.
billion. I am telling
Billion.
billion, sir.
Billions. Okay. How much? Normal concentration is something around 4 billion. 3 to 4 crore sperm, right? But when it reduces to the below the 10 million, sorry, 10 lakh, means below the 1 million. That is called the low sperm count. Many guidelines consider the 1.5 crore. Below 1.5 crore, it is considered the low sperm count. Many guidelines consider the 1 crore or 1 million. Many guidelines in the this is no, it maybe this is 1.5 million per ml, less than 1.5 million per ml, maybe. Right? Leads to the female infertility. Leads to the female infertility. Maybe this can also. Below the 1.5 crore, also called the low sperm count. Right? But different guidelines, friend, given the different opinion. But in general terms, we consider that if concentration level of sperm below the 10 lakh, that is called the low sperm count. Right? That is called the low sperm count, and patient need the treatment. And for what are the symptoms, basically, why this happen? Why low sperm count happen? Because sometimes hormonal imbalance. Major reason is lifestyle factors. Their sleeping time, their walking, exercise, or heat exposure, or oxidative stress. These are the main factor for the reducing the sperm count. Symptoms like low libido, sex करने का मन नहीं करना, low libido, erectile dysfunction, reduced facial and body hair, swelling or pain in the testicle. This is the symptoms by which we can identify the sperm status. How our brand is work? How our brand is work? Basically, in our brand, boost L-carnitine and L-tartrate boost the sperm energy. Boost the sperm energy production and motility. Withania somnifera, or we can also say the ashwagandha, they increase the testosterone level as well as they reduce the stress. Coenzyme Q10 as a good antioxidant protection and a lot of clinical trials we have also that so that the coenzyme Q10 improve the sperm count and sperm motility. Omega-3 fatty acid and zinc, they support the sperm structure, quality, and overall fertility. And vitamin B12 and folic acid, they maintain the DNA integrity and count level. These are the simple basic mechanism action. You can take a screenshot and just memorize this point. Whenever visit the doctor, explain like this simple point, because of that reason I simplified in the single lines. Right? You can noted it also. L-carnitine, L-tartrate, Withania somnifera, or ashwagandha, how they work. You can note this. These all the point. And wherever you go for the detailing, explain all the point to the doctor. Doctor is prescribing in the low sperm count, they know one thing, that is the coenzyme Q10. कि coenzyme Q10 अगर इसमें है तो वर्क करेगा, राइट? बट नॉट ओनली coenzyme Q10, आप इनको ऐसा भी बोल सकते हैं सर डॉक्टर, नॉट ओनली coenzyme Q10, many brands are giving the coenzyme Q10. But sir, what about the stress? When any parent, any couple have not the baby, they have the anxiety problem. They have a lot of stress. And stress management also needed. Because of that reason, for the male infertility, we have added ashwagandha as a very good stress reliever. And for the female, we have added the melatonin. Right? We have added the melatonin that reduce the stress. Clear? Same we are using in the male part also, because male have also the stress level if they have not fertile or they have not the baby. Okay, friend?
Yes, sir.
Sir.
Conclusion means how they treat along with the medicine, the lifestyle changes, balanced nutrition and effective supplementation improve the sperm health. Means along with medicine, these other things also needed for a good health. Targeting oxidative stress, hormonal balance, and energy metabolism enhance male fertility. And regular exercise, stress management, and healthy diet are key to improving the reproductive health. So if any patient taking the Low sperm count medicine, along with that, these necessary changes required for the sperm boost. Okay, this is the brief about our brand Spermify Pro. Why we added the Pro? Because here we have added the omega-3 fatty acid and Withania somnifera, means just like ashwagandha, right? So you can say the ashwagandha or you can say only Withania somnifera. Many times doctors just deny, I am not writing the Ayurvedic medicine, right? Many MBBS doctors denied. Because of that reason, here we have not written the ashwagandha, just written the Withania somnifera. For the knowledge, here we have written, but here not written as a salt, right? We have written the English name Withania somnifera because many time patients, doctors denied. But there we highlight the coenzyme Q10. Okay.
Yes, sir.
Yes, sir.
Have you any question related to Spermify Pro?
No, sir.
No.
No.
Okay. Chalo, go forward with one more brand, that is Euro Easy, right? A natural solution to cure UTI, urinary tract infection, right? Urinary tract infection. Actually, for the urinary tract infection, doctors mainly use the antibiotic, friend. But here we have given the cranberry extract, D-manose, potassium, magnesium citrate. Basically, what happened? Many time patient complain for the itching, acidity, and some burning issue in the vagina. अब these symptoms may be due to infection or maybe many times due to change of the nature, alkaline nature. If the vaginal pH is in alkali nature, right? But many times due to different infection or growth of the fungus, they change into the acidic nature, right? When the change happen because of that reason, even that they have not the infection many times, but they have the itching problem. So this medicine, this sachet generally used as a primary treatment, right? This basically sachet used a primary treatment in the fungal infection. So here we have added cranberry extract that prevent the addition of bacteria like E. coli and protects urinary tissue with the antioxidant property, as well as safe and effective alternative to the antibiotics for the long-term use. Because when long-term use the antibiotic, they cause the different side effect, right? So here we have given the cranberry extract. Nowadays, this combination is very popular in the market. A lot of company have this type of combination, right? No, this is the competitive molecule, but doctors are using very much. So what is the urinary tract infection, UTI? Urinary tract infection is an infection in any part of the urinary system which include the kidney, ureter, bladder, and urethra. Most UTIs are caused by with bacteria E. coli being a common cause, right? The E. coli generally cause the urinary tract infection. It is happen in the male as well as female, both cases, but generally happen in the female partner, not easily in the male actually. Okay. Cause of the urinary tract. Why? What is the reason why urinary tract infection happen? Because bacteria such as E. coli or women are more prone to the UTI due to their shortened urethra, which allows bacteria easier access to the bladder. Means in the female, their urethra is shorter as compared to the male. What is urethra? Urethra is a pipe or tube, you can say, that connect bladder to outer environment for the excretion of the urine. Bladder is a place, is a packet, you can say that contains the urine. Urine made in the kidney, then store in the bladder actually, right? Collect in the bladder and just one pipe connected to the outer part of the vagina for the disposal of the urine. That particular pipe called the urethra. The urethra is shorter as compared to the male. Male urethra is longer size. So in that scenario, the reaching of the bacteria or infection to the bladder is very difficult. But in the female part, it is easy because of that is an infection happen. Second, sexual activity can move bacteria to the urethra, opening increase the risk of the infection. And poor hygiene, because a female have every month the menses, the wetty area is maximum time. So chances is that they grow in the vagina, the growth of the fungal or the bacteria, right? So because of that reason, friend, the cause of UTI in the female is higher side and in the male is the lower side. This medicine can be used in the female as well as male in the both, right? But generally 90% cases is happen in the female. What are the symptoms? Symptoms like problem peeling, fever, chills, a cloudy, full smelling and dark peas, pain in abdomen, sometimes pelvic region or burning sensation, or pain during the sex or burning during the sex. These are the symptoms of the infection. These are the symptoms of the UTI. Types of UTI. UTI is a two type. One is the uncomplicated UTI, typically in the healthy individuals, often caused by E. coli. And second is the complicated UTI in individual with the underlying conditions caused by the various bacteria. In the uncomplicated UTI, friend, we are using this our medicine. In complicated cases, doctor prefer give the antibiotics also, right? In uncomplicated, we use our medicine, and complicated along with the doctor give the medicine along with antibiotics. Component and their role. But is how our brand is basically work in the UTI. Cranberry extract the may prevent the bacterial adhesion to the bladder wall. They remove the bacteria from the bladder. Basically, they prevent the adhesion, the stickiness, and some studies also suggest that it can reduce the UTI recurrence. Means they prevent again and again UTI chances. Second, demanage. They prevent the bacterial adhesion by competing for the attachment site. And potassium manganese, they maintain the basically pH. Sometimes the itching happen because of disbalance of the pH. If acidic pH is happen, then burning sensation or itching happen in the vagina. If we change the pH, then definitely we normalize the situation. So potassium magnesium citrate, they normalize the vaginal pH. They make the alkali nature in the vagina. So itching and burning problem will be sort out. Right? This is the brief about the brand. Euro is. So here, Sanjay, how is the name?
Yeah, it's good, sir. It's catchy.
It's catchy name.
Yes, sir.
Euro is, right? So you can promote this brand to gynecologist, to urologist, or consultant, everyone. Right? So
Yes,
because UTI happen in everywhere, but chances is higher in the female. And female many times is not surety by which this itching and problem happen. So that is just a precaution for the 1 week. Doctor give the each, right? Because this is not a antibiotic. They have not any side effect. Right. This is trending composition in the market. If you visit the gynae, every gynae prescribe this combination. Right? Just as a precautionary treatment. Urage. So it can moderate to severe UTI, burning micturition, recurrent UTI, and cystitis. Prescribe urage tablet. Urage sachet actually. Okay. Have you any question related to UTI or the Euro Easy?
No, sir.
No,
Euro
sir.
is.
No, sir.
So we have the last brand, that is Gyneval. So Gyneval, we have given the advanced version of progesterone. Right? This is the advanced version of progesterone, that is called the D. क्या कैसे पढ़ेंगे इसको?
Gynaval.
नहीं साल्ट.
Gyneval.
Dydrogesterone.
Dydrogesterone.
Dydrogesterone. Right? This is the advanced version of the progesterone. So basically, where we use the progesterone is a hormone. So dydrogesterone is a hormone actually. This is responsible for the stability of the baby. You can say that they nourish the baby. they maintain the pregnancy actually, right? Sometimes mishappenings happen, many times abortions happen, the sometimes threatening of the abortion after the 2 month, after the pregnancy of 2 month, 1 month, 3 month, miscarriage happen many times, right? To maintain the pregnancy for the healthy baby growth, then we need the dehydrogesterone like brand actually, right? So many patients have that miscarriage problem, abortion problem. In that case, doctor basically use the progesterone hormone. Here we give the advanced version of the progesterone, that is a dihydrogesterone. In the in the name of gynoval, in luteal support during ART, threatening abortion and maintenance of the pregnancy. Doctor, please prescribe gynoval, the brand of dihydrogesterone 10 milligram tablets. Safe journey to motherhood. Because of that reason, we give the punchline as a safe journey to motherhood. Right? The female can enjoy the motherhood journey. So how dihydrogesterone work? They basically support the pregnancy, prepare and maintain the uterine lining for the implantation and early pregnancy. Remember that yesterday I talked for the endometriosis one lining. I saw the one lining. Remember that? कुछ याद आ रहा है संजय?
सर
कल मैंने एक लाइनिंग की बात किया था यूट्रस में,
हाँ यूट्रस में जो
endometriosis में.
एंड ऑफ द नेम ऑफ द लाइन इज लेयर क्रिएट आने चाहिए
This one, this endometriosis lining.
सर
Right?
Yes,
This
sir.
endometriosis lining is responsible to take care of the baby.
बेबी
Right? So
Yes, sir.
what progesterone do? They maintain, they strengthen this layer, endometriosis. They maintain their layer, they strength, they give the strength to the endometriosis. So the home of the baby is stronger. So lesser chance of the abortion, right? Or lesser chance of the miscarriage. Okay, because
Okay.
for the strengthen of this layer, we need the progesterone or dihydrogesterone. Dihydrogesterone is the advanced version of the progesterone. They maintain this layer. So baby can easily stick or properly implant in the uterus and grow further. This is the basic work. That simple. Right?
Yes, sir.
Treat menstrual disorder like regular period, reduces heavy bleeding, elevate pains, manage endometriosis, and used in the IVF. When doctor do IVF, so before doing the IVF, they give progesterone or dihydrogesterone to the female to make the good endometriosis. Because after doing just if the endometriosis is strong, the chances of stability of the embryo is higher, right? The chances of the embryo or chances of the baby stability or implantation is the higher side. Because of that reason, they give the dihydrogesterone in the IVF, right? So dihydrogesterone is a synthetic progesterone similar to the natural progesterone used to treat the progesterone deficiency related to the conditions in the pregnancy. Indication. How basically they work? They maintain the uterine lining, balance hormonal level, strengthen the endometrial receptivity, prevent miscarriage risk, and help the endometriosis management. This is a very simple brand, typically 10 mg dosing. This is a very simple molecule. Just maintain the endometriosis, right?
Okay.
And this is our entire brand. If you have any questions related to this gynoval, you can ask. Sharad, which patient doctor give the gynoval?
Gynecologist.
Which patient gynecologist prescribe this brand?
Sorry, sir.
वे कहाँ पे गायनी वालों को कहाँ पे देंगे डॉक्टर्स?
They're pregnant, sir.
नो
early pregnancy patient.
Sir, early pregnancy patient.
No.
Sir, hormonal
Sorry.
hormonal imbalance patient, sir.
No. What is the main indication? The main indication of gynae that here this is a miscarriage, right? For the miscarriage, or those patients have the problem in the conception, means they conceive 1 month and every month they miscarriage. They're trying to conceive, conception happen, lady have the pregnancy, but after just 1 month the miscarriage happened, right? That time we need gynae. Okay, understand?
Yes, sir.
We need gynae for maintaining the endometriosis. So whenever pregnancy happen but not continue, miscarriage happen again and again, miscarriage or abortion happen, that time need the gynae, right? And in support the luteal support. Luteal means in the yesterday session I explained the phase. In the menstruation I explained the phases. Remember that this phase. And in this we have the have you remembered this chart? Luteal phase 15 to 20 years, uterus prepare for pregnancy, right? Uterus prepare for the pregnancy. That is called the luteal phase. In this phase, basically uterus prepared the strengthen the inner lining. That is called the endometriosis. They strengthen the endometriosis. If the endometriosis is stronger, strengthened, then definitely the chances of implantation of the baby is higher side. Right?
Yes, sir.
Okay. This is about our all brands. If you have any query, then I take the query. Otherwise, we will go for the lunch, right? For the 30-minute or 45 minutes, something around. And after that, we go for the detailing practice.
Okay.